Finger pain, causes and treatment. Finger pain can affect joint mobility and impact a person's ability to carry out everyday activities. Finger injuries, infections, tendon problems, and more can all cause finger pain. The fingers and hands are common sites of pain. Impact injuries, infection, and several health conditions can damage the joints, muscles, and other soft tissues, leading to pain. Due to the range of occurrences that can cause finger pain, the cause is not always clear. This video explores some potential causes of finger pain and their treatments. We also cover when to see a doctor and some self-care tips for finger pain. Identifying types of finger pain. Finger pain may have a clear cause, such as an impact injury, but this is not always true. Identifying additional symptoms such as swelling, stiffness, or visible cuts can help indicate what is causing finger pain, but medical assistance may be necessary to understand the cause fully. For example, a doctor may suggest the following to identify the cause of finger pain: physical examination, imaging tests such as X-rays, blood test. The results of this assessment can help identify the causes of finger pain and rule out similar conditions. Hand and finger injury. Injuries to the hands and fingers are common. This is particularly true for people who play sports or regularly use heavy equipment or tools. Causes can include falling on the hand, knocks and blows, jamming a finger, overextending the fingers or bending them too far backward. Injuries to the fingers can cause pain, swelling, and reduced mobility. In more severe cases, a person may dislocate or fracture a finger bone or damage a tendon or ligament. The fingers have 14 bones, and damage to any of them requires medical attention. Medical conditions. Several medical conditions can affect the muscles, ligaments, and bones in the fingers and hands. Unlike injuries, the medical condition that causes finger pain may not be clear. Stenosing tenosynovitis or trigger finger. Trigger finger is the common name for stenosing tenosynovitis, a condition that can occur due to inflammation in the tendon sheath in the base of the finger. This causes the finger to lock or catch when trying to move it. Symptoms of trigger finger can include pain and swelling at the base of the finger, difficulty bending or strengthening the finger, a popping or catching sensation when trying to move the finger, finger stiffness. Symptoms of the trigger finger may be worse when a person wakes up or after other long periods of inactivity. Carpal tunnel syndrome. Carpal tunnel syndrome affects the median nerve, which runs through the carpal tunnel in the wrist. Compression of the tunnel or swelling within it can affect the nerve, leading to pain, tingling, and numbness in the hands and fingers. The pain may start in the fingers and radiate up the arm. Symptoms may start gradually and worsen over time. Some people may also begin to experience hand weakness and difficulty gripping objects or performing precise movements. Ganglion cyst. Ganglion cysts are fluid-filled lumps that can develop near joints or tendons in the wrists and hands, such as at the base of fingers. These lumps can vary in size and may feel soft or firm to the touch. Ganglion cysts are usually harmless, but they can cause pain or tingling in some people. Doctors do not know what causes ganglion cyst, but they can develop in people of any age. Infection. Cuts and wounds on the hands or fingers can sometimes lead to infections. In addition to pain, an infection of the finger may cause swelling, skin flushing or warmth, fever. Osteoarthritis. Osteoarthritis is the most common form of arthritis. It occurs when the cartilage that protects the ends of bones wears down. Although osteoarthritis can affect any joint, it most commonly affects the fingers and hands. In the fingers, osteoarthritis can cause pain, stiffness, swelling, and bone protrusions. Osteoarthritis tends to develop gradually and may become worse over time. It is more common in older people and those who have experienced previous joint injuries. Rheumatoid arthritis. Rheumatoid arthritis is a chronic condition wherein the immune system wrongly attacks healthy tissue in the lining of joints. This can cause pain, swelling, joint deformity, and stiffness. Rheumatoid arthritis commonly affects the wrists and fingers, particularly the middle joints of the fingers, but it can also develop in other parts of the body. Other symptoms can include joints that are warm or tender to the touch, misshapen joints that may cause a bend in the fingers, numbness and tingling in the fingers, fatigue and a lack of energy, fever. Dupuytren's contracture. Dupuytren's contracture is the thickening of the tissues in the palm. This thickening can lead to the formation of nodules and cords that can reduce movement and may cause the fingers to bend toward the palm. This can lead to pain and loss of movement. Treatment and self-care for finger pain. The treatment for finger pain will depend on its cause. Trigger finger. In mild cases, treatment for trigger finger typically involves resting and immobilizing the finger, such as using a splint. Exercises and stretches may also help. For people with more severe symptoms, a doctor may prescribe steroid injections to help reduce pain and inflammation. If other treatments are unsuccessful, surgery to release the tendon sheath may be required. Carpal tunnel syndrome. Treatment depends on the severity of a person's symptoms and can include bracing the affected finger, undergoing physical therapy, and taking pain-relieving medications such as non-steroidal anti-inflammatory drugs and steroid injections. If symptoms do not improve, a doctor may suggest surgery to relieve pressure on the median nerve. Ganglion cyst. Ganglion cyst may resolve independently, and treatment is generally only necessary if they cause pain or reduce finger mobility. If ganglion cysts are causing problems, a doctor may recommend draining the cyst using a procedure called aspiration or surgically removing the cyst. Infection. People who suspect that their finger is infected should speak to a doctor. Without treatment, infections can sometimes lead to serious complications such as cellulitis, abscess formation, or even sepsis. Treatment depends on the type and severity of infection. A doctor may prescribe antibiotics for a person with a bacterial infection. Osteoarthritis. While no cure for osteoarthritis exists, treatment can help relieve symptoms and improve mobility. Treatment options for osteoarthritis include regularly exercising and stretching, managing weight, undergoing occupational and physical therapy, taking anti-inflammatory medications such as ibuprofen and steroids, having surgery. Rheumatoid arthritis. There is no cure for rheumatoid arthritis, so the aim of treatment is to relieve symptoms and prevent joint damage. Treatment options include taking anti-inflammatory medications, taking immunosuppressant medications, undergoing physical and occupational therapy, trying complementary therapies such as yoga, massage, and acupuncture, surgery. Dupuytren's contracture. People with mild symptoms may not require treatment. However, for more severe symptoms, a doctor may recommend surgery to remove the cords to allow the fingers to straighten. Self-care for finger pain. A person can usually treat a minor finger injury using RICE therapy, rest, ice, compression, elevation. Taking over-the-counter pain relief medications such as acetaminophen, ibuprofen, and naproxen may also help reduce pain and swelling. People who suspect a fracture or dislocation should avoid moving the finger and seek prompt medical attention. A trained healthcare professional will reset the bone and immobilize the finger to allow it to heal properly, which reduces the risk of further complications.